Welcome to ChemoExperts to learn about nausea and vomiting. We will discuss what is it, what does it look like, who gets it, and how do we treat it. Nausea is usually described as an uncomfortable or queasy feeling in the stomach. Patients may also experience stomach pain, lightheadedness, or an increase in saliva in the mouth. Nausea may precede vomiting, which is when contents of the stomach are forced up the throat and out through the mouth. Nausea due to chemotherapy usually begins within 24 hours after a dose of chemotherapy. However, some chemotherapeutic agents may cause delayed nausea and vomiting, which can occur 1 to 7 days after chemotherapy is given. Nausea begins with a queasy feeling in the stomach that can be mild or intense. Feeling nauseated makes it hard to concentrate on anything else and can cause anxiety and fear of vomiting. Although nausea and vomiting are closely related, not everyone who experiences nausea will vomit. Not only is vomiting extremely unpleasant, it can lead to serious complications. These include dehydration, electrolyte imbalances, weight loss, vitamin depletion, inhaling vomit into the lungs, or damage to the esophagus. Certain chemotherapeutic agents cause nausea or vomiting by affecting receptors in the stomach and the brain. When these receptors are activated by chemo, the brain sends signals to the stomach telling it to contract. The risk of experiencing nausea or vomiting depends upon the specific chemotherapy agents that you are receiving. This risk can be either high, intermediate, low, or minimal, and anti-nausea medications are chosen based upon the risk of nausea. Some patients can even feel nauseated when driving to the infusion center, or once they arrive before they even receive any chemotherapy. This is known as anticipatory nausea and vomiting. Other common causes of nausea include radiation, pain medications, a tumor in the brain or abdomen, constipation, an enlarged spleen, or infection. Nausea can be treated with one or more medications. A medication should not be selected until potential causes are investigated. Identification of the causes will increase the likelihood of the medications working. Depending upon the chemotherapy received, you may receive 1 to 3 medications before an infusion and another 1 to 3 to take home to use as needed. Additional ways to prevent nausea include sticking to bland foods, eating small amounts of food, eating food at room temperature, and avoiding foods with strong odors. Even though medications are given to prevent nausea, you may still experience symptoms. This is known as breakthrough nausea and vomiting. It is important to act on even mild symptoms of nausea, as many medications can take 30 to 60 minutes to work. If nausea becomes severe before taking your medication, you may end up vomiting up the medication before it has a chance to take effect. It's important to realize that dehydration can contribute to nausea and vomiting. If you are dehydrated and medications are not working, intravenous hydration may offer benefit. Many treatment options exist for nausea or vomiting. If you are experiencing either of these, talk with your healthcare team. Subscribe to our YouTube channel and tell us what you think. Click pause now to read our disclaimer, and thank you for watching.